So welcome to today's session, Systematic Review Overview. Thanks for joining us on this lovely Thursday. My name's Cynthia, and I'm an information specialist with Library and Information Services at UHN, and I'm going to be your speaker for the next hour or so. Today, we're going to be talking about the basics of planning and performing a systematic review. So this is just going to be an introductory session focused on the basics and how to get started. If you haven't tuned into our prequel to this session, The Right Review for You, I strongly recommend checking that one out as well. There is a recording available on our library website, and that session covers everything on different types of knowledge synthesis and helps you understand what type of literature review, whether scoping, systematic, or rapid, best fits your research question, timeline, goals, and purposes. I would like to kind of quickly introduce today's training team. Raluca is our workshop coordinator. She will be posting resources in the chat today. We have also Ruhi monitoring the chat since I can't see the chat right now or any of you while I'm presenting my screen. If you have any questions, she will address them, or if it's something that should be better addressed at the end, she's going to bring that to my attention. And at the end, I hope we're going to have a little bit of time to kind of have a discussion or answer some additional questions. Before we start, I would like to begin by acknowledging the land on which UHN operates, which is the traditional territory of the Huron-Wendat, the Haudenosaunee, and the Mississaugas of the Credit River. This territory is the subject of the Dish with One Spoon Wampum Belt Covenant, an agreement between the Haudenosaunee Confederacy and the Confederacy of the Ojibwe and allied nations to peaceably share and care for the resources around the Great Lakes. Today, Toronto is still the home to many Indigenous and Métis people from across Turtle Island, and our library is grateful to have the opportunity to work and learn on this land. In addition to respectfully acknowledging the land and its First Peoples, we want to recognize that hospital libraries can legitimize certain kinds of knowledge through the books and resources that we make available in our collections. Historically, libraries have privileged Eurocentric materials and ignored or excluded Indigenous knowledges. UHN Libraries is committed to providing a collection that supports Team UHN's efforts in working towards reconciliation. So as you think about and develop your research, even if you're not working primarily with Indigenous populations, we encourage you to explore and learn from Indigenous methodologies and Indigenous-led research. We have a few resources in our collection to help you get started, and we're also here to support your learning and your research. So please feel free to reach out to myself or any other library staff about these resources. And with that, we're going to be starting to talk about the systematic reviews. These are often very large projects. They're semester-long courses. There are some semester-long courses or full-week intensives to really teach you how to conduct a systematic review. And we're really only here for an hour. So to be brief, we're going to be boiling the process down to the 8 major steps, which are all driven by the research question. And we're very much focusing on getting you started on the right foot. So by the end of today's session, we hope you'll understand the steps to conduct a systematic review, recognize the importance of developing a protocol, the value of meticulous record keeping, and have an understanding of the need for rigor and effort that conducting a systematic review entails. So first, we're going to be doing a really short activity, just a feeler question. Please go to the link posted in the chat and pick what you think is the right answer for this question. How long do you think a systematic review takes?
We also got a few answers in the chat.
Thank you, Rihi.
Yes, no
I just saw them. So I have some people who said 1 to 2 years.
Yes,
I have 2 people 4 months. In the Mentimeter, everyone, okay, we're getting a few more answers. Most saying 1 to 2 weeks. Sorry, 1 to 2 years, and someone said 3 to 6 weeks.
Yeah, in the chat we have 2 for 1 to
4
2
months.
years and 2 for 4 months.
Okay. So I'm not seeing any more answers rolling in. So the answer generally is 1 to 2 years. There's really no perfect answer, but really kind of like a well-designed systematic review will generally take about 1 to 2 years. It's probably very difficult to do one in 3 to 6 weeks or even 4 months. It's not impossible, but you would need a really focused question, a really strong team, and a lot of capacity. If it's the first time you're working on a review, you'll find that a lot of the stages take a lot of time and you're going to be working on your protocol for a while. So most of the time is going to be a bit closer to the 1 year time frame, and I would say time and resources are a really common barrier to completing a systematic review. So kind of before we go any further, we're gonna, so that everyone's on the same page, what is a systematic review? Um, there are a lot of definitions out there, but here's one of them. Put simply, a systematic review is a summary of all the research, published and unpublished, on a particular topic. It's a type of review that uses systematic methods to collect secondary data, critically appraise research studies, and synthesize these studies. And it's important because if it's done well, it provides a reliable and minimally biased source of information. Unlike the other types of reviews, we have to be as thorough and unbiased as possible. Clinical practice guidelines are also guided by systematic reviews. And we're also doing this research to inform decision making. So we have to make sure that we're doing it correctly and giving the best care towards the process. It does require a great deal of planning, research, and time in order for it to be done well. But if it's done well, you're creating a really complete and exhaustive summary of the current evidence. Before we even kind of jump into the main steps, there's going to be a few things that you probably want to do before you get started. Like with any project, you're likely starting with a problem that you're trying to solve or address. Um, and you should probably be doing a little bit of research on your topic. I would recommend doing a background search. Find a handful of studies, and this really helps determine if you really need to do a review, or it helps you get a general understanding of the information landscape on your topic. I would do some searches in advance to see if your topic is already covered. You want to look for published review articles and protocols to make sure it hasn't been done or someone isn't working on the same topic. So some places that I would first look for are databases, protocol registers like Prospero, and also some of these open access repositories, such as Open Science Framework or Figshare, where people like to register their projects. You should also be researching the journal that you plan on submitting to. Have you checked that if they actually publish systematic reviews, and do they have their own requirements or guidelines? Is there a cost? And do you have a budget for your review? A lot of people believe it's an easy and free project because you're not conducting a clinical trial. You're doing research on research. But there can be some costs that you might want to consider, such as interlibrary loan, citation management software, um, systematic review software, other fees like gray literature searching, hand searching, staffing costs, publication fees. And you also probably need to consider your team. You're going to need a minimum of 2 people, but you probably need more. You should have members who are methodology experts, content experts, and ideally a search expert. If you're doing a meta-analysis, you're going to need a statistician. And depending on your topic, you might want to involve key stakeholders as well. Considering software, will you be using systematic review software? Who's going to administer the project? Who's going to manage the files and the data? And also thinking about the analysis piece. What kind of review will you be conducting? Are you going to have a narrative descriptive review, or are you going to have meta-analysis? So if you're uncertain about the type of review that you're conducting, you can take a look at our LibGuides, our LibGuide on the types of literature reviews, and it will give you a bit more details about how to do a narrative analysis or meta-analysis. But I kind of like to mention these few points because it helps you get started and also helps you determine if your project is feasible. Something else we recommend reviewing ahead of time is guidelines. And there's a lot of guidelines out there to kind of guide your process, your methods, what you want to be reporting. And one thing that we see is that a lot of people confuse these two types of guidelines, probably because they kind of go hand in hand. One is going to be methodological guidelines. So these are guidelines that kind of tell you how to conduct a systematic review. I'm just going to pull up one popular one, which is the Cochrane Handbook. And this one, they have guidance on kind of how to do the whole process. So from starting a review, thinking about your scope and questions, and also synthesizing your results. The other group is reporting guidelines. So these don't tell you how to do the review, but what you should be reporting on in your review or in your protocol or in your search strategies. You'll probably see Prisma referenced a lot in the systematic reviews that you read. And this is kind of like a checklist just to make sure that we have complete and transparent reporting in the final review. So now that we kind of talked about some of the prep work, we're going to be going through the steps involved in doing a systematic review. These are the steps that we're going to cover, and all of them are really driven by the research question. So I want to take some time to go over it to make sure we first have a focus and specific question. Because this is going to help define our search terms, our screening criteria, and how we're really going to interpret the data. Generally, it should have at least two components. And so then that means you can't really do a review on something like just heart failure, for example. You have way too many results and it's too broad. There are different frameworks that kind of help guide you in building a good research question. Here are two examples. One of them is the PICO model, where P stands for patient, population, problem, I for intervention, C for comparisons, and O for outcomes. So I'm just going to fill out kind of like my sample research topic. Let's say if I'm interested in figuring out if I should use heparin or warfarin for patients at high risk of pulmonary embolisms. From PICO, the population I'm interested in is patients at risk of pulmonary embolisms. The intervention is heparin. The comparison is warfarin, and the outcomes is how effective it is in preventing pulmonary embolisms. Um, I like using PICO because it really helps provide structure and makes your question clear, um, makes sure it's focused, and you can easily translate it to a research question above. So in patients at risk for pulmonary embolism, is heparin or warfarin a more effective treatment? You'll see that this topic or question really fits neatly into PICO, but it might not work as well with qualitative questions or more conceptual ones. So there's other frameworks, but another thing that people like to use is concept boxes. So this is a nice way to kind of break down your research question um, into your main search concepts. So what's the most important concepts for my topic? So my concepts would be pulmonary embolism, heparin, and warfarin. And I can also kind of use this concept table to start brainstorming some search terms. So once I have the research question, the next step is writing a protocol, and that outlines the rationale, hypothesis, and like how you're planning to do your review. It's important because you're carefully considering your project ahead of time and also demonstrates what steps you're intending to take to increase rigor and minimize bias. One of the expectations is really kind of knowing what you're going to do and outlining what you're going to do before you start. It's a great time for feedback on your process, increases transparency, and also ultimately enhances the quality of your review. In addition, there's plenty of rationale for registering a protocol and making it publicly available. For example, prevents effects of author bias. It allows feedback at an early stage. It lets us know if there's any changes to the protocol, and also it gives us a chance to kind of see how well that we're taking input, like from consumers, from patients, clinicians, and other experts. And if you're making it publicly available, other people can also see what you're doing, see that you're already working on that project, so it avoids unnecessary duplication and also encourages collaboration. The protocol stage, it it is a little bit of like a difficult process because you have to think about everything that you're going to do, but it's a great time to really pilot everything. You can try some searches, try your screening criteria, and also try your data extraction form. Um, Here is an example of Prospero. So this is they kind of have a guidance on kind of what you're expected to report in your protocol. So going down, for example, um, in your data extraction, they want you to kind of like report how disagreements are going to be resolved and if you're using any kind of systematic review software. Prospero is just one of many resources that you can use to make your protocol available. You could also submit to a journal that publishes protocols or use a repository such as Open Science Framework. And the next step is about searching. So this is not a searching workshop, but like we love talking about searching, and many guidelines actually recommend working with a librarian. So when it comes to searching, a lot of the times we're going to use a minimum of 3 databases. Very often it's Medline, Embase, and Cochrane Central if you're studying the effect of an intervention. But depending on your topic, you might want to add more, or like there's um, subject-specific databases as well. When you're doing a search, you have to think about any limits that you're putting. You have to carefully consider that, like stuff like language limits can introduce bias. We generally don't want a date limit, and if you do use one, you have to really, really justify it. It's not advised to draw an arbitrary line and say, I only want to look at results after the year 2000. Ideally, you're going to have to look at everything. Another thing is there's different types of searches for different purposes. And when you're doing a systematic review, the purpose of the search is really to kind of cast a really broad and wide net to capture everything. And so that means high sensitivity, but not very specific or precise. You're going to be getting a lot of results to screen, and most of them aren't going to be relevant. And that's normal and expected. There's also no right amount of results in your search or in the final studies included in your review. It really depends on your research question. So to kind of contextualize what I mean by different searches for different purposes, this one is a pretty basic search. So this is what I would do to find articles for a background search or just use it for standard literature review. While this is an example of a more exhaustive search on the same topic. So you're going to see it's far more detailed, far more broad. This is casting a really wide net which would be the expectation of a systematic review. And this is really a great reason for why you should have a librarian on your team. We know that having a librarian ensures that the search strategies are of high quality. If we have a good search, that means we're capturing all the relevant articles, and then they're going to be included in analysis. We also know that having a librarian in the process of securing grants is a key element in getting the grant proposals funded. For more kind of like if you want to see more information about like how we can support you, you can check out our knowledge synthesis support page, which outlines the different levels of support that we offer. So in addition to kind of doing the searches in the main databases, you might also want to add supplemental search methods like snowballing, citation tracking to kind of just make sure you got everything covered. Some people like to do hand searching of select journals or other methods to just find data that might not be published in traditional journals, like government websites, trial registries, or even contacting experts in the field if to see if they have more information. And kind of starting at the searching stage, something you might want to think about is data management. You're going to be managing a lot of data, and it's important to have a plan to kind of keep track of your records. There are plenty of citation management tools out there. And using something like a citation manager is valuable because it allows you to kind of create a library for your data and helps you manage it as well. And this is especially important because you're going to be expected to report the flow of your process following Prisma guidelines. And you're going to have to kind of report how many results you're getting, how many duplicates you've removed, and how many you've screened out, the reasons for excluding it, and how many studies were included in your final analysis. So once you've kind of like completed searching, what you have to do is kind of start screening after sorry. So once you've completed the searching and removed the duplicates, then you can start screening, which ultimately means taking your inclusion and exclusion criteria and reviewing each record to see if it meets those parameters. Your criteria could relate to study design, publication date, population intervention outcomes, and your criteria needs to be clear so that everyone's screening should have a good idea of what you want to look at. Here is kind of like a nice flow chart of the whole screening process. We look at the title, abstract, and full text. A lot of the times, the top two boxes, we often do the title and abstract screening at the same time. So if it's a clear no, we exclude it. If it's yes or unsure, then it goes to the next level of screening. We take all of these yes or unsure, and we get their full text articles and do the screening again using the same criteria. By the end of that, you want to be able to kind of confidently say yes to studies that should be included and no to those that shouldn't, and also kind of document why they shouldn't be included. If it's still kind of unclear, you can contact authors for missing information. And if it's still unclear after that, you can consider what else you could do rather than just excluding it. For example, you could list it in an appendix to make the data available, or doing a sensitivity analysis to see like if including that would affect the overall findings. In the screening stage, you're going to have to kind of keep track of all your screening decisions. So a lot of people also use systematic review software, and that kind of like helps you streamline the process. It helps you deduplicate, keeps track of your screening decisions, and manage your data by having data extraction forms. And this one, it might be of interest to people, might not. But a lot of these like software programs are incorporating AI. A lot is changing, but from the literature so far, the screening stage was the most popular step for applying AI methods. And what we're seeing is more and more software programs are incorporating AI. We know kind of some of the general concepts where the success of the algorithm really depends on the training data. And also, we're finding that duplicates can confuse the algorithm. This is probably something that we don't always think about because a lot of the programs already deduplicate for us. And I guess kind of like a general finding is that the performance really deteriorates without having some like human input, or they call it like human in the loop. Um, and I also mentioned this because like some of the tools are embedded in the software and it's a little bit more hidden. I'm just going to show a quick example with Covenants just because a lot of people use this tool. One of them is the relevancy ranking in their screening process. So this one, it basically sorts the articles that you have remaining to screen, putting the articles are more likely to be more likely to be included in your review at the very top, and the ones that are less relevant at the bottom. And this is really based on your screening decisions. So the more you screen, the better it gets at predicting. So you'll see that kind of towards the end, most of the articles are irrelevant, and people are finding that really saves time and kind of like reduces the workload, or at least like the mental workload to um, figure out if it should be included or not. Another one is the Cochrane randomized controlled trial classifier. And there's like two ways that you can use this in Covenants. One is tagging references, reporting on RCTs. So you still kind of have to like screen everything, but the tags make it a bit easier for you to kind of filter your results or screen out stuff if you're kind of limiting the study type to only RCTs. Another way is removing non-RCTs before you start screening. So this one, it reduces your screening pool to things that are most likely to be RCTs. You still have to kind of like verify and double check that it is, but it gives you a much smaller set to screen. And like I want to kind of mention a bit about AI in this workshop because it's continuously being improved and is becoming much more common. For example, that RCT classifier I was talking about, it's been calibrated to be very sensitive, but there are limitations. Like it's been only trained on health-related research papers, and they're also only in the English language. So it might not be generalizable for like different types of papers or for other languages. They're also finding that it works much better on the newer studies. And that possibly could be due to better reporting because we have um, uh, like more guidances on how to properly report your study. And I guess in other tools or like in other stages of the systematic review, we're kind of seeing hallucinations in the search strategy and also reporting plain language summaries. For data extraction or quality assessments, um, they're finding that the reliability can really vary and it really depends on the topic. So we're probably going to continue to need some human oversight and really carefully consider what we're doing, being aware of what tools are being incorporated in the software. So one of my key takeaways is to really kind of like follow the guidelines and policies. Um, and to be honest, everything is changing guidelines are taking, like guidance is taking time to come out and to kind of keep up. I'm going to show one of them. So this one came out recently. This one is Cochrane's draft guidance on the responsible use of AI in evidence synthesis. It's still a working document, but they, I would say, as a summary, they kind of like highlight the importance of kind of being transparent about when we use AI and really justifying it, kind of being critical of how it's been trained, if it's been validated, where it can work well, and what the limitations are. Okay, so after all of that AI talk, we're going to be kind of looping back to the steps. So now that you've kind of like finished your planning, your searching, your screening, you now have a small list of studies that are going to be included. The next step is quality assessment. I would say like this part is a really difficult step probably because it does, and it takes a while to kind of get used to the tool. But it's really important because the weight of a study is gonna like in the weight of a study for the findings is gonna differ depending on the quality. There's a lot of appraisal tools out there that kind of looks at the methodological quality and also the validity of the results. Some tools to assess the risk of bias for individual studies are ROB2, Robbins I, Robbins E. When you're combining studies for an outcome and looking at the certainty of the cumulative evidence for that specific outcome, grade is a very common tool to use. There's also grade circle if we're doing a review on qualitative research. The next step is where you extract your information from your studies. Very often it's a table format based on the information that you believe would be important about the studies and the outcomes. This information should be kind of planned in the protocol, and it should be really like meaningful and um, it does kind of like take some foresight and planning to kind of make sure that you're collecting information that's important to answer your research question effectively. One example is this article on the role of pharmacists in care transitions. And I'm just going to show kind of like examples of what you might report. So, for example, you might be interested in the setting, like what country, what type of hospital, what the sample size was, what the specific outcome was, the time frame that they measured these outcomes, and also the effect. And for the next step, you're going to be analyzing your results to answer your research question. So kind of like what steps or what type of analysis you're going to use. Like, are you going to use risk ratios? Are you going to have a descriptive summary? Are you going to have tests of heterogeneity for meta-analysis, forest plots? And these kinds of analysis are really depend on your data and the type of review you're doing. And this one is kind of our last step. So you're going to be writing the interpretation of the results. So this will address questions like, what has your review uncovered? What new insights does it provide? And what impact will it have? Very often at this stage, you're going to be drafting your manuscript in full. So while writing it up, we recommend kind of like following those reporting guidelines I was talking about before, like Prisma, and also looking at the guidelines for that journal. What do they need you to include for a systematic review? One very last point is like, what do you do after you've published? Just because it's published, it doesn't mean the work is done. Kind of keeping the audience of your research in mind, you might want to there's like a few things you have to consider, like what's the best strategy to kind of promote your work, making sure that the people who need to know about it will know about it and also will apply it. What knowledge transfer activities have you planned? Some grants kind of require you to have a plan for knowledge translation in your proposal. Some questions are like, how will you spread the word? In your organization or in your peer group, your field, or the world? Will it be spread in the news, presented at conferences? Are you going to use social media? You might want to prepare a plain language version for the public. And while like these are just a few suggestions, I also want to kind of highlight one of our resources that we have, which is the publication cycle. So this one has kind of like more information on what you do after your research about knowledge translation, how to communicate it to non-researchers. But we also kind of have more information on what to do before you start your research, help for writing your manuscript. And that is the end of kind of the presentation portion. Raluca is going to be posting a link in the chat for our feedback form. We always appreciate feedback on these sessions, kind of like what worked well, what we could improve on. Did you like the AI content? And if you ever need us to to contact us at all, feel free to email us. Here's the library's general email at the very bottom. But you can also visit our contact us page for a list of individual contacts. And also kind of like as a reminder of like what other services we do. We offer free literature searches, database training, and that's about it. We do have a little bit of time for some questions and answers. So I'm just gonna check the chat.
We haven't had any questions so far.
Okay.
So, but I see someone is typing, so might be a question.
Okay, I'll wait a bit.
Yeah.
So one question is, are the services for lit reviews only reserved for UHN employees? So our like our free services are for like UHN staff and learners. So you have to kind of be affiliated with UHN in some way. If you're kind of like outside of the organization, we also have something called Health Search, which is a paid service that they can help you with like regular lit searches or even like a search strategy for systematic reviews as well. Thank you everyone for joining.